We do orthodontics, we do Invisalign here, and that is a big part of the smile makeover. Making your teeth are in the right position before we even start touching them is important. You know, you want to be conservative. We only get one set of teeth in our life, and you know, the less changes to the shape of the teeth we have to do by positioning them in the correct place is really important. Because a lot of times, a lot of my patients can achieve their natural smile that they truly want by just moving the teeth. You know, of course, everyone thinks, you know, orthodontics, braces, that's about straightening teeth. But in reality, it's about long-term function. Your teeth need to be in the right place to function together. Your teeth work as a team. So if they're not correctly aligned, then they start kind of clanging and banging instead of sliding and gliding. And we can start losing and breaking teeth easily. It plays a big role in hygiene. You know, if you've got some teeth that are covered or overlapped, it's harder to perform oral hygiene. And so it has many functions. And I think that the aesthetic ending of orthodontics, that's the icing on the cake. But there's a lot of other things that orthodontics, aligning your teeth, can provide. You know, we do want patients to feel good. We want them to look good. But what's more important is that they're able to function, that they're able to keep a healthy smile, they're able to keep their natural teeth as long as possible. Now, of course, if teeth have to go, then we're honest. You know, we don't want to have our patients wasting their time and money on teeth that we know may not last them long, and give them options. In the end, they are in control. It's their teeth. We want them to be happy, and we're just here to guide them to make sure it's the healthiest, safest way to do so. So Invisalign, you're wearing these clear liners for about 22 to 23 hours a day. You're taking them off when you're brushing and flossing, when you're eating. So it is quite the commitment. So every time you have a snack, you got to take them out. And then when you got to put them back in, you got to brush and floss all over again. So that's the kind of commitment we're talking about, because if they're not in your mouth, they're not working. So most cases can last anywhere from 6 months up to 12 or 18 months. It depends where we're starting out. Many of our patients had ortho as children or young adults. You know, they had that bracket phase. And we all have learned that if you stop wearing your retainer, your teeth move. So maybe they just need a couple months of Invisalign to shift their teeth back into alignment. Some of our other patients have never had ortho, so it may take a little bit longer. We're talking about 8 to 12 months or a little bit more to get them nice and aligned. And this can be done on any patient. You can be 18 or 88. We have had some of our older patients do Invisalign, and it works out really well for them. And for them, it wasn't an aesthetic concern, it was a functional concern. They were having trouble flossing and brushing some of the teeth that were rotated and overlapping, and now they're easily able to take care of their teeth for the long term.